Yeah, roll up your sleeve. So this will be just doing it for upper extremity vasculature. So first thing, we're just gonna bilaterally ask the patient to roll up both their sleeves, and we're just gonna be inspecting their skin. So we're gonna start and just basically have them roll down, making sure that there's no rubor or discoloration, making sure that there's no scars or abnormal swelling, looking for abnormal masses that would indicate indicative of tumors. Along those lines, we're looking for different hair patterns if there's anything there. Looking at the backs, looking to see if there's any scarring or rough edges on the elbows, depending on the work. Then we're just going to basically go through and we're going to palpate the sides, making sure that temperature is the same. Texture, we're just going to see if that's any different depending on work or anything like that, their occupation, if there would be any difference there. Then we're going to look at it, ask them to spread their hands out, look at their hands and nails. So we're just going to do a skin or dehydration test. So take a pinch of the skin, let go, and it should basically reflex right back into where it came from. Then we'll do a pinch test. So we'll take a fingernail and pinch down, hold that for 5 seconds. Should return in 2 seconds. Okay. If there's anything else that would be missing here. Seems about right. Okay, so then now we're going to go through palpation, and well, we've already gone through part of it. So first thing we're going to go through is just have them check the radial pulse. So taking 2 to 3 fingers, radial pulse. I'm going to go over and do ulnar pulse. Okay, side, radial. Make sure that I don't have a ton of pressure there to occlude it. Ulnar. Okay, and then we're going to do the epitrochlear and notch. So have their arm about 90 degrees, and then about 3 centimeters in. And we're just feeling to make sure that there's no enlargement at that point. Commonly, that would be like a metastasis for cancer area in the epitrochlear node there. Okay, and then we're going to go through some lymph nodes in the shoulders. So we're going to do the anterior lymph node. So we're going to have someone raise their hand up. Their anterior lymph node, and then lateral, which will be basically right below the arm. There. Okay, and then posterior and superior lymph node. On the other side. Okay, just making sure that these all feel normal. There's no enlargements there, anything along those lines. Then we're also going to check the brachial artery. About that, so just making sure that or the brachial pulse should be there. Okay, okay. And then we're going to just do Allen's test on both hands. So we're going to flip their hand over. We're going to occlude both. We're going to find both the radial and the ulnar arteries. We're going to occlude them. Ask the patient to make a fist and hold their hand while we occlude their arteries, and then open. Then we're going to release the one, and skin should flow back. And then we're going to have them repeat that, make a fist, and release. And then we're going to release the other artery. So going from ulnar to radial in this case, and making sure that would be normal. And we perform the test on the opposite side. So ask the patient to make a fist, hold that, all right, release, and checking radial artery, and make a fist, release, checking ulnar artery. Yeah.